Top story is that the BBC has found there's a postcode lottery when it comes to GP care. It means that doctors in some parts of England are struggling with 3 times as many patients as those in other parts of the country.
The Royal College of GPs says it's the result of years of underinvestment, as our health correspondent Nick Triggle reports.
There are 34,000 GPs in England, around one for every 1,700 patients. But these doctors are not evenly spread around the country. NHS England figures show that GPs in some areas have to deal with 3 times as many patients as those in others. In Rushcliffe, in Nottinghamshire, there are nearly 1,200 patients for every GP. But in Swale, in Kent, there are over 3,300 patients for every GP. Some variation is to be expected. An area with a high number of older patients or lots of young children is likely to need more doctors. But the Royal College of GPs said some areas were struggling with shortages, describing the differences as shocking and a risk to patient care.
For the areas that are really struggling the most, we need extra effort right now. We can't wait for the doctors in training to come through the many years that it takes to train to be a GP. We've had targeted enhanced training schemes which are great and which are helping. What we also need is to look more widely at the problem. In the short term, are there other healthcare professionals that can help out and support the GPs?
NHS England says 5,300 additional nurses, pharmacists and other health professionals are working alongside GPs in primary care, and an extra £4.5 billion is being invested as part of the NHS long-term plan. Similar data is not available for Scotland, Wales and Northern Ireland, but GP recruitment is known to be problematic across the UK. Nick Triggle, BBC News.